friends, today we are going to discussing about new chapter, role of the government in health. Okay friends, what is health? Health means our ability to remain free of illness and injuries. If people do not get adequate food to eat or have to live in cramped conditions, they will be prone to illness. Healthcare in India. In order to prevent and treat illnesses, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors and other health professionals who can advise, diagnose and treat illnesses. India has a large number of doctors, clinics and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. This is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. Healthcare facilities divided into two categories: public health services and private health facilities. First one is public health services. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illnesses to special services. The health service is called public for many reasons. In order to fulfill its commitment of providing health care to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Another important function of health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with the participation of people, otherwise it is not effective. Second one is private health facilities. There is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds registered medical practitioners. Urban areas have a large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are also shops from where we buy medicines. Healthcare and equality. Is adequate healthcare available to all? Services are run for profit. The cost of these services is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. In order to earn more money, these private services encourage practices that are incorrect. At times, cheaper methods, though available, are not used. For example, it is common to find doctors prescribing unnecessary medicines, injections or saline bottles, when tablets or simple medicines can suffice. Hence, even for those whom one might not think as being poor, medical expenses cause hardship. What can be done? It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. It is important to work on both in order to improve the health situation of our people. The Gala Experience. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development and education. Health centers were improved. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in South America. The main reason for this can be found in the Costa Rican Constitution. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its people. The Costa Rica government provides basic services and amenities to all Costa Ricans. It provides safe drinking water, sanitation, nutrition and housing. Health education is also considered very important and knowledge about health is an essential part of education at all levels. Okay friends, I hope all of you understood this lesson. We will meet you next lesson. Bye.